yourself. We're a small group, so.
I'm Julia.
And Julia?
Yuval.
Yuval. Okay.
Sadie?
And Sadie. Drew, okay. I know you, Drew. Okay. Okay, good. So, we're going to talk about HIV in India. But first, I'd like to ask you a couple of questions. The first question is, why did you choose this topic?
I know that HIV/AIDS is actually a serious problem that's going on around the world, but since we're living in India, which is also like a poverty, kind of, it's like a food organ, so I thought how it would relate to some kind of topics. Well, kind of similar to Sadie, that I knew that HIV was a serious problem in India, but I didn't know much about it, so I thought that
Okay. Okay, good. And I know Ms. Lockwood is your health teacher, right? You all are taking health, I suppose?
Yeah, a couple of them have it with another colleague of mine,
Oh, okay.
but yes, they either had health last semester or they are having it this semester.
Okay. So I guess maybe you haven't done it yet, but you'll learn about HIV and you probably know some things already. But I'm going to ask you a few questions just to get an idea of what you might know, and that way I don't have to repeat things that you might already know. So do you know what HIV stands for? Human immunodeficiency virus. That's right. And what is HIV? Is it a disease?
It's a virus.
It's a virus.
It's a virus. So it causes a disease.
Okay.
And what do we call the disease?
AIDS.
AIDS. And what does AIDS stand for?
Acquired.
The I is the same as in HIV.
Acquired immunodeficiency. Wait, what?
Now, all of you are taking health this semester, right? Okay, so we haven't gotten to
You haven't
the
gotten
sex
to it.
unit. So
Okay.
hopefully, if they had taken health last semester,
They
they would
should
know
already
these
know.
basics.
Okay, well that's good.
We do address it.
That makes it easier for me, because I don't have to wonder what you already know. It's acquired immunodeficiency syndrome. So it's not actually a disease. It's a syndrome means it's a collection of different symptoms and diseases that can cause you harm. And so a person who gets infected with HIV and then later gets AIDS will usually die of some other disease that they get because they have AIDS, because their immune system becomes weakened. Okay, so that's what HIV does. It attacks the immune system. And you probably know the immune system is what helps you fight diseases. So if your immune system becomes weak, you can't fight diseases, and then simple diseases which other people might never get because their immune system fights, or diseases which they might get but they wouldn't harm them, a person with AIDS could die from them, okay, unless they get treatment. So where is my computer that I can click and move slides? It's over here, okay.
I think, isn't it?
Is there
it's a touch screen, so,
Oh, really?
yeah, so
Wow,
I think
never
you
used
just
touch
touch the
screen before.
screen at one time, double, yeah, okay?
Okay.
Yeah.
Okay, well we just sort of went over this a little bit. HIV versus AIDS, and this is something that people confuse all the time. They say, I'm sick with HIV, and you might not be sick with HIV. You might have HIV and look absolutely healthy and feel healthy and be able to continue your life as well as anybody else. Because HIV is a virus, but it doesn't necessarily make you sick until after a number of years. So HIV is the virus that causes HIV infection, which can lead to AIDS. A person can look and feel healthy even if they have HIV, and a person with HIV can pass it on to others. We'll talk about a little bit how that happens later. And AIDS, HIV weakens the body's ability to fight diseases, and that can make a person sick. It can take years. Usually, if there's no treatment, it can take on average about 10 years for someone who gets infected with HIV to get AIDS. And during that 10-year period, most of that 10-year period, they'll feel perfectly healthy and perfectly normal, and they won't even know, if they don't get a test, they won't even know that they have HIV. And a person with AIDS can pass HIV to others. I think you'll be able to get this, so you don't have to write everything down. Yeah.
If you have HIV and so say you don't have AIDS and you just have HIV, can you pass that to someone too?
Yes. Yep. And just here's a little bit of detailed information, which I don't know if you'd like to have details, but when the person gets infected with HIV first, the HIV is a virus, and you know viruses replicate, right? They make babies, baby viruses, and immediately in the body it replicates quickly, and so the number of HIV that are in the body goes up very high. Then your immune system starts to fight the HIV, and it kills off some of them, and the number of HIV starts to go down. And then it'll stay at a low level for a lot of years, but it won't completely be gone from your body. With other diseases, if you catch a cold, your immune system fights the virus, and it gets rid of the virus completely, and you get healed, and the cold is finished. But with HIV, that doesn't happen because the immune system's not strong enough, because the HIV is killing the immune system at the same time. So there's a kind of a balance that happens where the HIV and the immune system are fighting each other for a period of 10 years, but after about 10 years, the body starts to lose, and then the HIV virus starts to increase again. And the reason I'm telling you this is because when there's more HIV in the body, that's when you can pass HIV to somebody else more easily. And when there's less HIV in the body, the chance of passing it is less. So that means in the very beginning, when you're first infected, that's a very risky period. And when you start to get sick after about 10 years, that also becomes a more risky period. But the biggest problem is that first period, because when you start to get sick, you might go and see a doctor, you might get a test, you might find out you have HIV, and then you can do things to prevent from spreading it. But in the beginning, you don't know you're sick, but you have a high chance of passing it. So that's the period where most of the infection gets passed from one person to another, is in that very beginning period. So how is HIV spread? This is the part where kids usually giggle and feel embarrassed.
I know 3 ways.
Okay.
One is having sexual intercourse with a patient who is infected with HIV/AIDS,
Okay.
and another is like sharing needles,
Mhm.
and the last one is a mother to baby.
Okay. And there's a fourth way. It can happen in hospitals when if somebody is a patient and if the doctors and the hospital staff are not careful and the medical equipment gets contaminated with the blood from the person with HIV, and then that gets used with another patient, or a blood transfusion which isn't properly tested. If a patient comes in and needs blood and they get blood that's already infected, that's another way in which the virus can be transmitted. So, but you're right on the first 3 also. It can happen by unprotected sexual contact with an infected person, by sharing needles and syringes with someone, if you're using drugs, if you're injecting drugs like heroin, by reusing medical equipment, as I mentioned, or through blood transfusions, and then babies, you mentioned that babies can get it from their mothers. Basically, it's in 2 ways. One is if the mother is infected, then she might pass it to the baby when the baby is being delivered, during labor and delivery. And the second is during breastfeeding, because the breast milk can carry the HIV virus. So there's 4, basically HIV lives, well, it lives in different parts of the body, but it can be transmitted through 4 different bodily fluids. One is semen, which comes from the man. One is blood. One is vaginal fluid, obviously comes from a woman. And the fourth is breast milk. And those are the only 4 fluids that can transmit HIV. And that's important because people always ask the question, can you get HIV from kissing? And saliva is not a way that you can transmit HIV.
Can I ask a clarifying
Yeah,
question?
sure.
So I understand that it can be passed through oral sex, which is, contact with the mouth with the, so then which fluid is that? Is that blood then? If is there a cut in the, or a wound in the mouth that allows it to happen?
It could be, but usually it's transmitted from the person who, it's transmitted to the person who's using their mouth. So it would be semen or vaginal fluid that would
Okay,
then
I see.
But it's a good question, and it's a fairly low, I mean, it's a risk, but it's a low risk compared to
Low
other
risk.
sexual behavior.
Right.
If the person who's using their mouth has cuts, that's when it normally can happen. Because if it gets in the digestive system, it would normally be killed in the
And
digestive.
we addressed this in health class, which is why I wanted to really clarify
Yeah.
this point. Thank
Yeah.
you.
So HIV is not like a cold. You can't just catch it, okay, by sitting next to somebody. You can't catch it from hugging. Well, there's a long list of, I gave a few common things that people tend to ask, but there's, of course, lots of ways you can't get it. I won't tell you every way you can't get it. But from, people greet each other by kissing often. You can't get it that way. You can't get it through insects. Even though mosquitoes take the blood from one person, what happens with mosquitoes is after they bite somebody and they take the blood, they go somewhere and they digest that blood. They don't go from person to person to person biting. So, and then in the process of digesting, the virus doesn't survive. So mosquitoes can't transmit. Saliva, tears, sweat, these are all bodily fluids, but they don't transmit the virus. Okay? Hugging, handshaking, if you share each other's food, if you drink from each other's glass, none of those ways. Okay? Or bathing using sporting equipment. So some global information before we come to India. They are estimated, and it's only estimated because there's no way to really know the exact numbers, 34 million people alive in the world today with HIV infection. And that is about 0.5% of the world's living population. So now you guys are studying some statistics and math, I think, right?
Yeah.
Okay. So here's the math part of this project that you get to, I could have had you calculate that yourself, right? There's 7 billion people in the world and 34 million people living with HIV, and then you can come to this 0.5%, right? AIDS has killed more than 30 million people since we have known about AIDS. It might have killed even more people before we knew about it. Does anybody know when we first knew about AIDS? (1981). 1981.
Didn't it spread to India in 1986?
In 1986 was the first case in India. Where?
In Chennai?
In Chennai. Yeah. So it came to India a little bit later. The first cases were found in the United States, and in 1981. Now, an interesting thing is that in 1978 there was a group of men who had hepatitis B in California. Hepatitis B is another disease, and it's also another disease that is carried in the blood, and it can be transmitted in many of the same ways as HIV. And they did a study of these men, and they collected their blood, and then they froze it because they wanted to take a look at it again in some future years. They didn't even know about HIV at that time, but when they looked at it later in the 1980s, they found that a number of those men had HIV in their blood as well. So we know, even though our first cases of AIDS showed up in 1981, we know that people were infected even as early as 1978, 3 years earlier. The other interesting thing is that in 1981, the reason we found out about AIDS is because somebody got sick. And I told you already that it takes 10 years to get sick. So that means it was 1971 when people started getting infected. So we can go back at least that far and know that at least as far back as 1971, people were getting infected. And probably even earlier. I think they found there was a pilot from 1949 or something who his body had been preserved, and they did some research on it and found that he was infected with HIV. So it's been around for a while, but it didn't start growing until we started seeing it in 1981. In sub-Saharan Africa, that's where most of the infections in the world are. And in some countries, not all countries in sub-Saharan Africa, but in some countries, especially in southern Africa, South Africa, Botswana, Zimbabwe, the rates of HIV are very high. It can be as high as 20 or 25% of the adult population. So that's really very, very high. India doesn't have such high rates, but if you count the numbers, it has very high numbers. And India is the third country in the world with the highest number of HIV. The first is South Africa, the second is Nigeria, and the third is India. And India has, we estimate about 2.4 million people with HIV. And you know how many people are in India? 1.2 billion. So now you have to calculate the percent. Math problem. Math problem, that's right. That's why I like this topic, because it has math, it has science, it has humanities, culture, interactions between people, right? History, I told you a little bit of history already. It has everything all wrapped up in one. I think all the topics have that. But that's why I like this project. So what caused the epidemic to spread so rapidly? Why did we see it all of a sudden in the 1980s? Well, the answers are here. I was going to ask you, but they're all right in front of you. People started to travel more. That was one reason. Airlines, international airlines, commercial airlines started to become popular, so people started to move around. So if they had HIV, they could take it with them to some other place and then start spreading it in that other place. So that's one reason. The blood industry, syringes, let's see, well, blood became routine in 1848, but we weren't testing blood for HIV, so that was one way in which it spread very quickly. And even in some places like in China, that continued very late, probably even in India too, although India has been pretty good about, at least since the 1990s, getting their blood supply cleaned up. And drug use. In the 1970s, we saw a big increase in the use of heroin. And drug use is probably the fastest way that HIV is spread. And you'll see that because I'll show you the data for drug users in India, and the rates that they have is much higher than the other groups. So if you look at countries, we like to put things in categories. And we can put countries in categories according to what their infection rates are in the country. We say a country is in the initial stage when HIV is just starting to spread, that there's only a few cases, and it's mostly among people who practice high-risk behaviors. So in high-risk behaviors, you already mentioned, Sadie, you said drug use, right? And sex. Okay, not all sex is risky for HIV, but some sex is, and we'll talk a little bit more about that. So when it's only in those groups, and the percent in those groups is less than 5%, we say this is just the early initial stage of a country's epidemic. A concentrated epidemic is when the infection starts spreading rapidly in those same groups, and the rates get higher than 5%. But it's still not very common in the general population. And the generalized population, which is what we see in places like South Africa, is where the rates are more than 1% across the whole population, not just in specific groups. So which stage do you think India's in?
Concentrated.
Concentrated, yep. So, HIV in India, the problem. Before we do the problem, we're going to do a couple definitions. Do you know what prevalence means?
Is it prevalence something spread like the way spreading of HIV?
It's a really good word for vocabulary class that you should be learning from me or Mr. Daly at some point when we get to talking about like how common is depression and how common is these things.
So prevalence is it's a measure word. It's a word that we use when we are talking about the proportion of people who are living with a particular disease in a given population in a given time frame. Usually the time frame is 1 year. It could be, we could have any time frame, but usually we talk about 1 year. And incidence, and prevalence is going to come up a lot in this presentation, that's why I'm doing this. Incidence won't come up as much, though it's a very important word, so I thought I would throw it in there. Incidence is the number of new infections that happen in a given population, in a given geographic area, in a given time frame. So they're very similar, but there's a difference. It's a small difference in that prevalence is everyone who has a disease, and incidence is only the new infections, the new disease acquisitions in that period of time. So if you have a disease that is a very short disease, like a common cold, which may last for either a dozen days or 12 days, one or the other, right? If you take medicine, it goes away in a dozen days, and if you don't take medicine, it goes away in 12 days. It's a short disease. Incidence and prevalence will be almost the same, because all the new infections that happen this year are the same people who have the infection this year. But if you have a disease that's chronic, that lasts a long time, like heart disease or like HIV infection, then incidence and prevalence are not the same. And so what happens with HIV is, I said people can have HIV infection for 10 years. When we talk about prevalence, all those people over 10 years, they get, when I look at today, I'm measuring all the people who have that disease, who got it this year, last year, the year before, back 10 years ago. Everyone who's still alive with that disease. But when I measure incidence, I'm only measuring those who got the disease this year. Okay, so incidence will normally be lower than prevalence. But incidence is more important in many ways to understand, because it's when you're trying to prevent a disease from spreading, you want the incidence to go down, right? Because you want there to be fewer new infections. But you don't necessarily want prevalence to go down, right? Because people who already got infected, the only way to make that number go down is if those people die, right? So when you hear people talk about the country's HIV prevalence, and they say it's very high, that might mean the situation is really terrible, or it might mean the situation is getting better, because people are living longer. If instead of counting people for 10 years, we're now counting people for 20 years, the number is going to go much higher, right? It's a little bit complicated. Think about that. So now into the data for India. You guys have been learning how to make and read graphs, right? In math? Okay. So this is a graph that shows the prevalence of HIV among people in India each year over the last, well, up till 2009, the last 5-6 years. Okay? And the prevalence is actually, the bar shows the number of people. Whoops, I'm not supposed to touch it, right? I'm not used to the touch screen. Okay, the number of people, PLHA means people living with HIV and AIDS.